Shall we start, sir?
How we can start now.
Good afternoon, everyone. I'm Dr. Kirti Suda from Dr. Makkar's Diabetes and Obesity Center. The topic of today's session is reclaiming health in the COVID era. The COVID-19 pandemic has had direct or indirect effect on mostly all of us. Many of us, including our children, have been staying at home with work and schooling from home as a new norm. We have been doing less in terms of social interaction and physical activity. This has given a negative effect on our mental and physical health. People with chronic diseases have also been affected in this period, both directly as well as indirectly. Actually, there was a shift seen in the focus of management of acute diseases and neglect towards chronic diseases, as most of us avoided visiting doctors and going to the hospitals. So, dear friends, now is the time to reclaim our health, focus on our mental and physical health. This pandemic has made us realize the importance of health. So, today's session is all about reclaiming the health. And today we have Dr. Makkar with us to guide us on how to stay physically and mentally healthy in this COVID era. Good afternoon, sir.
Good afternoon, Dr. Kirti. Good afternoon, everyone.
So my first question to you of the day is, actually, what important aspects of our health have been affected in this period?
So I think, there is hardly any aspect of health which has not been affected during this period. First thing was, the virus itself caused a lot of disturbance. Anybody who got infected had multiple, adverse effects of that COVID infection. There was acute phase when the people were at home or hospitalized, sick. Then if they were hospitalized, then recovery periods were having a lot of problems. People did not recover fully in a week or 2 weeks. And there is something now well-established entity called long COVID that people are having symptoms even 3 to 4 or 6 months after the COVID infection also. Second thing was the lockdown. Lockdown led to confinement within the homes. Now, two different things happened to two different kinds of people. One, there was a set of people who were always tired of running from one end to the other end of the cities, and they felt that was a big relief because they were sitting at home and working from home. So they were more relaxed to begin with, and they were comfortably working from home, and they were enjoying the home cooked food. And since they were at home, they were having more opportunities to eat. So people were getting, into indulgence, I would say. No physical activity, increased eating, staying at home led to increase in weight for a lot of people. And if you remember that time, most of the people were putting, their recipes on Facebook or WhatsApp daily basis because everybody was experimenting with cooking. There was nothing better to do. So everybody was kind of indulging. So those people gained weight and started having problems with, if they were diabetic, their diabetes control worsened. The other reason was there was nobody available to treat those diseases like diabetes or high blood pressure or heart disease, because most of the hospital setups or the clinic setups were either working with COVID or were closed. So the care for these diseases got neglected on one side. Other side, indulgence, weight gain led to worsening of these conditions. So this was one aspect. There were second kind of people who were confined to home but lost jobs, were stressed. They were, there was loss of income. There were loss of near and dear ones, leading to phenomenal stress within the families. Everything was shaken up. So they were not able to take care of their diseases, pre-existing diseases, or they did not take, whatever we can say. But the in the net result was that again, diseases like diabetes, hypertension, heart disease got neglected. There was another set of people who utilized this opportunity to focus on their health also. So they became cautious about eating, because once they were working with the offices, they were eating outside good number of times. There were parties, so all the parties were stopped. The extra overeating was stopped. They were getting home cooked healthier food. They got more time for their exercise, so they focused on exercise. Those people improved their health also. But this was comparatively smaller number as compared to the other number which had worsening of health. Then there was a lot of stress. Stress, as I mentioned, because of loss of near and dear ones, loss of jobs, confinement at the home. Some people felt that they were getting quality time. They were spending time together with the family. There were some people who were fed up, because they were seeing this as a difficult situation to all the time interact with the family continuously. And there was, once you are sitting there were a lot of husband wife disputes happening. So those things were also there. So there are things which we can't even imagine that were happening during that period, and they were affecting health, all kinds of areas of health, whether it was mental health, physical health, chronic diseases. Acute illnesses fortunately decreased that time, because people were not eating outside, so stomach infections were lower. People were wearing masks, so chest infections were lower. You hardly saw anybody having cough, cold during those days, or fever during those days. If there was fever, it was COVID fever. So there was total, disruption of normal lifestyle, with the impact on health largely on the adverse side for most of the people.
Very true, sir. It was a real bad period.
Yeah.
So what we can do to keep ourselves healthy? How can we now improvise the things? As we have started seeing, the number of cases have started declining, and hopefully we'll be in a good situation.
So the basic, principles of maintaining good health will remain same. You have to be, cautious about your eating habits. You don't need to indulge every single day. Even if you indulge, suppose you are one person who does not gain weight with the, eating outside or eating extra food, it's fine. Keep a check on your body weight. Make sure that you exercise regularly. Eat healthy food. If you have any pre-existing illness like diabetes or blood pressure or heart disease, make sure that you are continuously taking your medication. You are in continuous touch with your treating physicians. Even if it is on video consultations or teleconsultations, you must be in touch with them, and you should be always in contact with them for the ongoing treatments that you have to take. In case there is slightest uh, mm, chance that you are getting into COVID or some other infection, make sure you consult the nearest doctor or your physician to make sure that you are not starting with a new illness. And of course, you have to focus on stress reduction. By all means, you can do that by doing some regular meditation, yoga. Even regular walk is a very good stress buster. If you go out for a walk for 45 minutes, it is shown to reduce stress significantly. There are many things that you can do.
So very important points which you have illustrated. Now, I would like you to take one aspect one by one. Like,
Okay.
let's start with healthy eating. What do you mean by healthy eating, and what impact does it have on or during or after COVID situation?
So healthy eating means, once we say healthy eating means, it's you are having a good eating behavior. So you are having 2 or 3 square meals, and you usually eat on time, and you don't overeat on regular basis, or you don't kind of indulge into uh, what we should say, the pleasurable foods, what we call this is a hedonic eating, where food becomes a stimulus to increase your appetite, and you see a pizza, you would like to take a slice whether you are hungry or no. Somebody is eating a burger in family and you are at home, you would also like to have a small bite of that burger. Or somebody is, your wife is cooking good parathas, and kids are having, you also want to have those parathas. So this is called hedonic eating. This is the food is such pleasure that you want to eat anytime, whether you are hungry or no, whether it is time to eat or not. So maintain a good eating behavior. Don't indulge too much into eating. Second thing is, make sure your food is a balanced food. You are taking adequate, carbs, adequate proteins, adequate fats. But making this into carbs, proteins, and fats is usually difficult. So largely we work on the foods that provide these, components. So ideally, whatever you are consuming, the plate of food, we have the food plate concept. At least half of it should be fruits and green vegetables. A quarter of it should be anything cooked from the cereals and pulses, and other quarter should be the pulses or meat, and of course as low amount of oil should be used as possible, because that is the calorie dense component of the food. So a quarter into coming from cereals and grains, quarter coming from pulses and meat, and half coming from greens and fruits. You should, there is one more fancy, is that everybody wants to take fruit juice. This is kind of very good for health. Actually, no juice is good for health. You are consuming excess calories and you are throwing out a lot of fiber from the fruits that have their own good value. And you are kind of making it a sugar concentrate. The minute you drink it, it gives you a sharp kick on the sugar. Fine, it provides you instant calories, but it is not a good option to have juice or soft drinks, which people take constantly. So this is one component that you should focus on: balanced diet. Second thing is, when you have occasions to eat outside, or you have get together, somebody is coming to you, make sure that you don't tend to overeat. And whatever foods you opt for, try to avoid the excess oil from that food. So you are outside, you don't need to have all kinds of gravy foods or parathas. You can still have chapati, you can have food which has less oil, you can go for the more of the grilled foods and salads and fruits there, rather than going for all the butter chickens and butter paneers, which are loaded with fat and providing you unnecessary excess calories. So you can make decent food choices any point of time. And of course, one should try to refrain from overeating. Another important thing is, one can make a good habit of weighing oneself on regular basis. So if you don't want to weigh yourself daily, you can do it every week. And you should keep a track on your weight. If you are not gaining weight, it is fine. You are eating whatever you are eating. And make sure, if you are about 30 or 35 years of age, keep checking your all blood parameters, which include kidney function, liver function, cholesterol, thyroid, every year, so that you know where you are going wrong the minute you are going wrong. So all these things are important to make sure that you are on right track for the food part or the eating habits.
So you always talk of the food plate, one fourth, and half. Is it so key? Every time we have a meal, we have to have our food in the form of depicted in the form of food
No.
plate.
So it should be the overall consumption in the day can be distributed into 4 halves. So like one meal you are dividing the plate into these areas. You can divide the whole day meals, the full day of eating that you are planning. You can divide into that. Like morning, you are having more carbs. Naturally, you are not taking more fruits and more salads. So you are taking more carbs. Maybe afternoon, maybe you can have more salad and less of other foods. At dinner time, again, you can take more protein or whatever food you want, and a small serving of salad or curd. you can choose.
Basically, we should know what we are eating. We
Yes.
should have a vision and a clarity of our food.
Yes.
So now next thing is exercise. We have seen two aspects of exercise. We have seen a group who has been totally avoiding exercise, and we have seen another group which has been more into fitness. They have been going for regular workouts in some way or the other. But what exact type of exercise is required, and how to manage exercise during this period?
So, exercise, basically, what do we mean by exercise? Exercise is any kind of physical activity which is a planned thing, and it is a, it is planned with the aim of improving or gaining on health. Any physical activity is actually exercise. So, if you are doing household work, it does not define as exercise because it is not focused on your health, but it adds to the same benefits as the regular exercise will do. So any physical activity is good for health. Now, it is more relevant in Indian setting because in India, our body structures are different from the Western people. We have more fat per kilogram of body as compared to the Western population, and we have less muscle mass. Now, muscle is the tissue which is involved in metabolism also. So if you have less muscle mass, then the chances of getting into insulin resistance or diabetes or heart disease or cholesterol and all these issues are higher. Second thing, if you are not exercising, these muscles basically are attached to bones. So once you exercise, they put stress on the bones. In the process, the bones also remain healthy, right? People who do not exercise, their bones also lose more calcium, and they are more prone to falls and fractures. So in Indian setting, because we have higher fat and lesser muscle mass, we are more prone to diseases like diabetes, heart disease, blood pressure, and so on. So if you are regularly exercising, you are trying to maintain that muscle mass on the positive side. Ideally speaking, in Indian settings, some amount of muscle training is also advisable. But at baseline, whatever wherever we look at the guidelines and whatever guidelines are available globally, there is a general consensus that to maintain health, you should be walking at least 30 to 45 minutes on daily basis, at least 5 days a week. So brisk walk or equivalent moderate or moderate intensity, activity. I'm just, not remembering the exact term. So it is called moderately vigorous physical activity, MVPA. So that level of activity for at least 30 to 45 minutes should be undertaken by everyone on daily basis, and should be done at least 5 days a week. Now, Indian setting, since we have poor muscle mass, it is recommended that we do this exercise for a little longer duration. And at least thrice a week, we also do some stretching, muscle training, or isometric exercise for at least 15 to 30 minutes, at least thrice a week, so that we can improve our muscle tone and muscle mass, which helps in overcoming the bad effects of excess fat also. Now, once you are exercising, it is not just that you are improving muscle and cutting down fat. Exercise improves your cardiovascular fitness. That means your heart becomes safer. Your heart risk is reduced. It improves your breathing continuously, so your lungs are functioning better. Because of the improved muscle mass, you are at lower risk of all kinds of diseases. Because you are walking or moving, your joints are in good order. Your bones are healthier. Your balancing is better. And once you are exercising, it has a de-stressing effect also. So your stress levels generally come down with exercise. So anybody should do a regular exercise. The simple ones are brisk walking, or equivalent is cycling or swimming. but you can opt for other exercises, like you are confined at home, you can download videos. Dance is a good exercise. Playing some, near outdoor games which can be played within the housing complexes, like badminton or things like that. They are very good exercises. So one can choose and do exercise. But exercise is as a regular part of lifestyle is very important to maintain good health.
Another very important issue which we have been seeing in this period is there has been rise in childhood obesity. And last time we had two questions on this childhood obesity also. Now I would like you to explain it to us ki how can we tackle this situation of childhood obesity. And so one more question in reference. Do you see in your clinical practice also, are you seeing increase in childhood obesity?
Yes, I think childhood obesity is increasing for almost a decade now in India. And there is recent time, yes, there has been a marked increase because the children were confined to home. They were not going to school. See, for children, if they are going to school, this involves a lot of physical activity. Most of them are walking to the bus stop, they're boarding the bus. In the bus, they are playing with their friends. They go to school, they have to walk around in the school, they have to go to ground, they have, sports class or exercise class also. So there is pretty good amount of physical activity which is involved in schooling or going to college also. That activity was zero. Second thing, their interaction with their friends was limited to WhatsApp and chatting. Third thing, you know, since they are alone at home, and particularly the single child families, parents are also busy working. They are also working on laptops. So there is no physical activity at home. There is boredom. They are connected to their friends on WhatsApp. For how long they will remain connected? So one of the ways of to kill boredom is pleasurable foods. And the food is now easily available. We have enough Zomatos and Swiggies, and every restaurant is supplying food to your doorstep. So there is increased availability of food which is calorie dense or high calorie, and there is decreased physical activity, and there is stress. It may not be visible. It may not be visible. There may be subclinical stress because they are not meeting anybody, they are getting bored. That also gives stress. So all this is leading to increase in the weight gain.
So this period has affected our mental health because of so many reasons, what we have been talking about. But how can we take care of our this mental health issues?
So there are a lot of things which we can do, simple things. Like I said, a regular walk is a stress buster, right? So just regular walk is a good stress buster. One can look at meditation. Well, rather than exercising, you feel okay. Going alone for walk is not good thing. You can download a video, and you can or you can play songs which you like to listen to, and you can dance on them. That is also exercise. You can meet friends over a game of badminton or something. Within the complexes, if people are wearing masks, maintaining social distance, it is not that you can't meet people or you can't go for walk in a group. We have very regular walk groups within our society. I still go for walk and in fact during COVID period also, we never walked again because everybody was wearing mask, maintaining distance, and making sure that nobody is in harm's way because of another person. So once you are interacting with people, you are going in fresh air, you are seeing greenery around, it changes your, mindset. You are disconnected from your routine or your routine surroundings for maybe 45 minutes or 1 hour, which actually is a good stress buster. Second thing is you can always, have more connect within the family or more positive interactions within the family and with the friends, and also do some meditation or whatever, as long as you are able to keep busy. And if you are doing what you like doing, usually stress is not a problem is when you are, suppose you are in a work or in a job which you don't like, and you are anyway stuck now at home and still doing that job sitting on the screen. then it is very stressful. But if you love your job and now you find that, oh, doing on screen, I can do better. It is not a stress. You are actually happy. So stress is also a lot to do with your mindset and perception. But there are small, small things which help. One is regular brisk walk. I think it is a big stress buster. And this is what I tell all my patients or all the people I know, that you must walk at least 45 to 60 minutes a day. It is not going to improve only physical health, it will improve your mental health. Keep yourself involved in positive activities. Focus on your work. Try to do better than what you are doing. That itself gives you a very good satisfaction. Okay, I was doing till last year. Despite limitations, I did some better work this year. That's a very positive feeling that you get and cuts down stress. You can, keep your hobbies on. You can do gardening. You can listen to songs. You can watch movies. There are enough OTT platforms. There is enough junk to keep you busy. So there is, but yes, there are people who are hardwired to get easily stressed. We can't say that, stress is just because you are not trying to avoid stress. There are other factors also. There are family factors. There are genetic predisposition. There is inheritance. There are social circumstances, or the, people who lost immediate family members. You can't tell them that you can't, you leave stress. There is stress, but you have to tackle that stress positively.
We should not feel shy if we need any counseling or any
Yes, of course.
psychological
That
support.
most important
We
thing
should
is, if you're not
accept
able
it.
to cope up with stress, must consult a psychologist or a psychiatrist. Should not keep sitting at home. And if it is not that person has to do it. Somebody in the family has to identify that this person needs help, and there is no stigma related to it.
Yes.
Mental illness is not somebody is doing it with purpose, or is not avoiding it. There is a lot of genetic and epigenetic factors which lead to mental illness also. Not everybody responds to these stress factors in the same way.
And especially in case of kids or teenagers, we have to be very vigilant.
Yes.
Any abnormal change in behavior, any change which was not previously there, we should be very particular in all these things.
Yes.
So another very important aspect which we have seen is there has been rise in diabetes during this period and post period also. So how to tackle with this issue? We have been repeatedly talking about it, but I would like you to please.
Some patients actually got diabetes, possibly because of the COVID virus leading to direct damage to pancreas. That is something which nobody could help. But certainly, as we discussed, we had the adverse impact on lifestyle. People stopped exercising, gained weight, stopped going to their physicians for treatment, did not adhere to the medication or lifestyle changes. So all this has led to increase in the risk of developing diabetes, as well as worsening of the glucose control levels. And as we have already discussed, I think focus has to be on regular physical activity, judicious eating behavior, and regular monitoring of glucose. These are things which every diabetes patient should focus on to stay healthy. People who do not have diabetes, the slightest doubt that they are losing weight, they are having increased hunger, which was not there earlier, they have increased urination frequency, or anything unexpected. A routine health check is a must for every patient, because we don't understand what COVID can cause damage to in every patient. We know certain things that we have observed, but there may be so many things which we don't know also. So slightest of doubt that health is getting compromised, one should get a proper health check. And during that health check, a screening for sugar is also must.
So there's a question from Shruti Hasija. She wants to know, sir, please tell, if we have no space for walking, can we replace with treadmill?
Yes, you can do walk on treadmill, you can use a static cycle at home, or you can dance in front of your TV or music system. There are so many ways to do exercise, provided you have to start focusing on exercise.
So another very important question, very beautiful question, I will say. Can open gym, which is being provided by Government of Delhi, can open gym exercise using gym equipments available in Delhi parks can be replaced with walking? And exact,
So walking has its own benefits, and if you look at the benefits of exercise, the largest amount of studies are with brisk walking, right? These open gyms actually offer you something like a mild muscle training, and this is good for health. As I mentioned, 3 days a week you should do some muscle training also. So these gyms are not offering you excess weights or something. These gyms, what I have seen, basically make you work with your own body weight. If you are doing some weight exercise, or otherwise they are general stretching exercises. So any exercise is good for health. And if you can't do those, you don't want to do those, just do brisk walk on regular basis, 5 to 6 days a week, at least 45 minutes, that I would say. I don't believe in 30 minutes. I want at least 45 minutes we should do it. And that should maintain your health. That will prevent 95% of the diseases of adult health, including cancers.
so protein, this is another question. Protein alternatives available for vegetarians for elderlies.
So elderly, see, the best protein alternative for elderly is paneer, because it's easy, soft, easily available, easy to chew. You can cook it the way you want. You person can eat it raw. Your person can eat it in a curried vegetable, dry vegetable. That's the simplest thing. Now, people who are vegetarian, there are a lot of them who eat egg also. So egg is a very good protein. Third option is, of course, soya protein, but soya is, whatever form it is available, it is little difficult to chew. So, but you can use the smaller size grains. Soya is a good source of protein, and milk and milk products. All milk and milk products are good source of protein for vegetarian people.
So just give me a second. I'll go through the questions if anyone is left.
Sure, sure, sure.
So Shruti is saying she feels very low at the time of exercising. Any suggestions for her?
I think she is one of our patients. She is
Yes.
diabetic and she must not be controlled if she is not checking her sugar. So she has to make sure if she is her sugars are controlled. If sugars are not controlled, then she cannot go for any intense exercise.
So this COVID-19 has caused a havoc all over the world. Though now we are seeing a dip of the number of cases, but we still need to be on guard, and COVID appropriate behavior has to be strictly followed. So any other point you would like to add? Anything which I have left you would like to add?
So another important point I think that we should discuss is the alcohol consumption, which has increased or decreased. Both has happened during this period. When the initial COVID started, people said, no, spirit is a very good disinfectant. So people said, you drink alcohol, it will, uh, what, sanitize your throat. So it will have antiseptic effect. Now, in fact, there was this discussion was in across the globe, and EASO, I think, came up with a guideline for alcohol consumption during this, and they demystified a lot of things that consuming alcohol is not beneficial. So, alcohol consumption has increased because of stress, because of confinement to home, and so many reasons. So consumption of alcohol has to be in moderation. It is very important, because if you are consuming excess alcohol, it is not only going to worsen your existing diseases, it is going to predispose you to more diseases in adult life, and also it is going to decrease your immunity and make you more prone to COVID. So excess alcohol has to be avoided by all means. Moderate alcohol means less than 60 ml on daily basis, not more than ideally if you are consuming, by definition, all 7 days a week is okay, but it has to be less than 60 ml. But this is based on the Western data. India, our body size, our body weights are smaller. So the recommendation, I think, should be close to 45 ml, not 45 ml of hard liquor, more than 45 ml on any day. And it is those people who don't drink, best avoided. People who have diabetes, it is best avoided. It has no, kind of additional benefit. But those who consume have a very disciplined alcohol consumption. Fine, it is okay. It doesn't harm you also then.
And so one more important point which I forgot is refrain from smoking.
Smoking is to be, smoking every single cigarette is a problem. So I think smoking is not advisable to anybody. It's a socially also, it is not an acceptable thing that somebody is smoking and next person is inhaling smoke for no reason. So I think smoking is to be avoided by all means.
So we are through with the questions and my stock is also over.
Good. Then we are finishing kind of, we usually finish by this time only. So we are finishing on time. And let's have another, some important topic next week also.
Sure, sir. So thank you everyone for joining. Stay safe and have a blessed festival season.
Thank you, Dr. Kirti. Thank you all the viewers and listeners who have joined for this show. Thank you, everyone.